Good evening to everyone and welcome to today's session. I hope another 8 more tests, probably 4 more weeks, back to back, Wednesday and Sunday, we have got a marathon session. You are all lined up, fully gathering the energy, ready to fight the exam. It is an equal disadvantage and advantage for everybody who are suffering a common constraint of time. So let us make the start. I invite all our online students who had been patiently waiting for a half an hour delay. So let's make the start. Is the voice clear? I hope so. The innervation of the rotator cuff muscle that medially rotates the arm is by which nerve is an important question. Basically there is a upper and lower subscapular nerves. The upper and lower subscapular nerves, they innervate the subscapularis muscle. What is the specialty of the subscapularis, doctor? Subscapularis, it is the only muscle of the rotator cuff that medially rotates the arm is what need to be remembered. Our Vijayawada students, everybody asking 500 topics which I promised to provide. Actually it is in Excel sheet. It need to be converted into PDF. Our DTP guy didn't come. Otherwise definitely by tomorrow evening we will try to upload the PDF of the 500 most high yield topics. Just bear with me, it is actually in Excel sheet format. After the analysis of the frequency with which the questions come and based on the DNB question bank also, we came up with a short list of 500 topics from which there is a great likelihood of getting the 240 questions when we go to the exam in view of the short time available. Now, unlocking of the fully extended knee. Typically for the flexion, it requires the contraction of which muscle? It is the popliteus which contracts. It causes the medial rotation of the tibia and enables the unlocking of the knee is what need to be remembered. Now coming to the metacarpophalangeal, proximal interphalangeal and dip joints. What is the role of radial nerve? Once more, anything we discuss, finally we come to the same place. Musculocutaneous, ulnar, radial, median. These 4 you should swallow because invariably there is going to be 1 out of 240 questions from this. The radial nerve, the thumb metacarpophalangeal extension, abduction of the thumb and the fingers metacarpophalangeal extension and the extension of the wrist, they are all fundamentally because of the radial nerve is what you have to fundamentally remember. If there is a sensation of fullness in the rectum before going to the nature call, what is the main reason when the rectum get distended, the people get the defecation reflex? The sensation is basically produced by the pelvic splanchnic nerves which originate in the S2 to S4 sacral root value is what you need to remember. Splenic artery is the one which is in close relation with the body and tail of the pancreas. That is the reason whenever there is a pancreatitis, what happens, doctor? Splenic vein thrombosis can occur is what you have to ultimately remember. I won't leave you without asking questions because Wednesday and Sunday, the purpose of me is to basically ask you questions. Age more than 60, you shoot me an answer. CD34 positivity, MDR phenotype, chromosome 57, trisomy 8, FLT3. These are all the poor prognosis for of ALL, AML, CLL, CML. Which malignancy? Who is going to give me the correct answer? You said myeloma. Myelodysplastic syndrome was the answer. Brilliant answer. So it is slightly away. Yes, our Anantapur students say AML. Kiran says CLL, Vizag say ALL. Nobody said CML. Okay. And Dr. Anuja from Pune says AML. AML, doctor. You will remember me when you write the exam in the Prometric Center. This question will definitely come. FLT3 gene mutation, MDR1 phenotype, CD34, chromosome 57, T69, trisomy 8, you need to remember. Obviously, you know, no? ALL mein what is the prognosis? Poor prognostic factors. Age less than 1 or more than 10. Increased WBC count. Or a ALL patient had a Philadelphia chromosome. Or if there is a CNS involvement. Or there is a L3 morphology. They are all associated with poor prognosis in case of the ALL. The list of the factors you are not going to basically forget. Now, what is the role of testosterone? Basically, in the embryonic life, the gonad will be indifferent. It becomes a testis if there is androgen, testosterone exposure. So there is a reason the fetal testis development from the indifferent gonad and the descent of the testis also. They both require the testosterone in the embryonic life is what you need to remember. Now once there is an elevated estrogen levels, what is the influence of it? When will estrogen levels will be elevated, doctor? There is a follicular phase and a proliferative, post-ovulatory secretory phase. During secretory phase you have abundance of progesterone. During the follicular phase you have abundance of estrogen. A high estrogen, what it should do ideally, by 14th day when the ovulation occur, it should prepare the system for the ovulation. How will it prepare? It will increase the ciliation on the epithelial cells of the fallopian duct. Same time. So the moment ovulation occur, already fallopian tube is having well developed cilia and they will let the ovum propel and swim to reach the Mr. Sperm is what need to be remembered. Now left adrenal drains into left renal vein, right adrenal drains into IVC is what you have to fundamentally remember. Now coming to the tactile and positional sense, the long tracts, doctor, you have to remember for the tomorrow's exam thoroughly. You know very well fasciculus and cuneatus, fasciculus, cuneatus and gracile. What do they do? The dorsal columns will go ipsilaterally without decussation until they reach the lower part of the medulla. There they decussate and go to contralateral side and travel as medial lemniscus. If you do a cut or a damage to the medial lemniscus, who is going to get affected? Opposite side cuneatus, gracile get affected. Hence you will get the contralateral loss of the tactile and positional sensation if you happen to interrupt the medial lemniscus is what need to be fundamentally remembered. Posterior inferior cerebellar artery, it supplies lateral part of the medulla. See doctor, pons medulla midbrain, lateral medial. You must know what structures are lateral, what structures are medial. Medial medullary, lateral medullary, medial pontine, lateral pontine. Medial midbrain, lateral midbrain, all syndromes, 6 syndromes, which you have to remember. What is Benedict, what is Weber, what is Wellenberg, everything. Now doctor, if you look at the lateral part of the medulla, you have the nucleus ambiguous, spinothalamic tract, descending tract of the fifth cranial nerve, nucleus tractus solitarius, everything. But where is the pyramid? Pyramid basically contains the corticospinal path, will be passing through the pyramid. Pyramid is there along the medial part of the medulla, not the lateral part of the medulla. Hence involvement of the corticospinal tract only arises if there is medial medullary syndrome, not lateral medullary, is what you are going to ultimately remember. Let me wake you up from the sleep. I am asking you a question, you are answering. Tell me doctor, a low serum iron, high TIBC, low ferritin, increased serum transferrin. What is your diagnosis? Whereas low serum iron, low TIBC, high ferritin with a normal serum transferrin. First one in diagnosis A is what? Iron deficiency, very good. Diagnosis B is anemia of the chronic disease. One big clap go to our all the students, because one question, thalassemia, iron deficiency anemia, anemia of the chronic disease. Invariably tomorrow while you are answering in the prometric center, you will remember me on that day. Now if you ligate the basilar artery, it won't interrupt pica. Why? Circle of Willis doctor, anatomy of circle of Willis you should know without confusion. Two vertebral arteries combine to form basilar. You all agree? And the basilar ultimately will divide into two posterior cerebral arteries. The superior cerebellar artery, anterior inferior cerebellar artery, they both arise directly from basilar. What is the purpose of the basilar artery? It supplies the brainstem, medulla, pons and midbrain, everything. Whereas pica, posterior inferior cerebellar artery, which supplies the lateral part of the medulla, it directly originates from the vertebral artery. Today only you are going to revise tonight circle of Willis, which is going to be the question in the tomorrow's exam. Adrenal medulla, it receives the preganglionic sympathetic fibers, as all of you know very well. So you know what is least thoracic splanchnic, lesser thoracic splanchnic, inferior mesenteric ganglion. I leave to you the literature for you to review, but autonomic nervous system anatomy, sympathetic chain, parasympathetic innervation, everything you must be sure.